My name is Mike Collins. I study health sciences, and I plan on being a doctor of physical therapy in the future. I've worked at the Ohio State Motion Analysis Lab for 2 years, and today I want to present you my research. For my project, I evaluated how posture and movement training affected two patients who had non-arthritic hip disease. This is a clinical condition characterized by bony abnormalities, poor movement patterns, pain, and dysfunction. The purpose of our study was to identify if a 3-week posture and movement training during physical therapy would improve gait mechanics and patient-reported hip function. We analyzed 2 participants in a case series. They came to our lab before and after posture and movement training. During lab testing, they walked in our 3-dimensional motion capture system. You can see here on the screen how data is translated from real time to the computer to recreate each participant within our software. We chose to look at hip extension during gait because most patients with NAHD understride, producing little hip extension. We hypothesized that posture and movement training would increase their hip extension, which would normalize their gait and improve their patient-reported hip function. As predicted, our participants showed less hip extension during gait at baseline. After intervention, both participants increased their hip extension to look more like typical gait, but at different rates. Furthermore, both participants improved their patient-reported hip function by clinically meaningful difference, but not by acceptable outcomes. In conclusion, we saw that patients increased their hip function and improved their walking gait mechanics. We hope that in the future, patients and clinicians can use this information to decide whether they should continue with physical therapy or pursue surgery. I'm looking forward to doing Denman this year because Denman will give me the opportunity to discuss my research with students and faculty outside of my laboratory. I'm looking forward to promoting good discussion and feedback about how non-operative treatments can affect the current healthcare model with these patients.